I'm Dr. Gary Clayman of the Clayman Thyroid Cancer Center at Tampa, Florida. Today, we're going to talk to a patient about they have a new thyroid cancer. What are our next steps?
Thank you, Dr. Clayman, for this opportunity. I just found out that I've got thyroid cancer and I'm freaked out. I want to know, what are my next steps? What do I need to do? What's the big picture here?
The first portion of the big picture is to take a deep breath. Relax a little bit. Thyroid cancer is very, very common, and it is exquisitely rarely an aggressive cancer.
Most of the time it's curable.
Most of the time it's curable. So what you want to do is get composed, become informed, and find the right people to help you through this process.
The right people, do I need a chemotherapy guy? Do I need a surgeon? Do I need an endocrinologist? Who should I be seeing? What kind of doctor do I need?
Great question. So you actually need two doctors. You're going to need an endocrinologist, and the endocrinologist is going to be dealing with a certain aspect of your treatment, your evaluation, and your treatment. And then you need to find a really outstanding thyroid expert surgeon.
Do I need to worry about chemotherapy, or that stuff? I worry about that stuff later.
So the great thing is that in almost all thyroid cancers, you don't need to worry about chemotherapy, and even very, very rarely need to be concerned about any type of radiation treatment. So the most effective treatment for thyroid cancer is surgery. So that's what we have to keep our eyes on.
Okay, so a little bit later I'm going to ask you some questions about how to find a surgeon, because that's really important. I get that, because if I'm going to be cured of my thyroid cancer, it's because I'm going to have a good surgeon remove it completely. But what about an endocrinologist? Do all endocrinologists do thyroid cancer stuff, or do some do mostly diabetes? Or how do I know, how do I pick the right endocrinologist? Can I just ask the question?
I think that's the perfect answer, is to ask the question. There are endocrinologists that specialize in thyroid and thyroid-related problems. There are some endocrinologists that treat the whole spectrum, the whole field of endocrinology, and they may be really excellent at it, but they may not be particularly comfortable in managing thyroid cancer. So I think that should be a discussion, and sometimes your local doctor, your primary doctor, may very well know the local expert for you to see.
So it sounds like I just need to not freak out. I'm going to be okay. I've got weeks or months. I think we're going to talk about this in a different video, but I don't have to do everything this week. I've got time to do this. It sounds like one of my first steps are identifying my two doctors. Who's going to be my endocrinologist and who's going to be my surgeon? I think that's my first two steps. And I got to educate myself and read about what my disease is causing me.
Exactly. And you need to undergo the appropriate evaluation for your thyroid cancer by a really expert individual or individuals that understand what that evaluation should look like.
Okay, think that I'm going to ask you those questions in another video, what tests I need to get next. But for this video, I think you answered my questions with a big picture. I know what I'm going to do now.
Great.